I'm Dr. Nandita, working as a fertility consultant at J. Hospital, Nahar. Actually, my approach to a patient totally changed after getting into this course. And it was very helpful in a way. See, it's an online course, so we can make time for it even with our routine duty going on. I'm new to the infertility department, like I'm just now starting to see the patients, like to get into IVF, and I'm happy I joined the course so that even from the beginning I'm able to adhere to the protocols, the basic things, so that it is very useful in my practice. Maybe a small ovulation induction or it is an IUI, the techniques they tell, a little modification and enhancement gives a good outcome for us, right? So that is more important. And the counseling, how to counsel, that's more difficult in our practice, the counseling a patient. So we have to know our subject in depth so that we can counsel them at more ease, so that they'll get to understand more. So these are the few practical points which I learned here. So no one will teach us, right? I feel like I have come back to my UG classes where you are exactly taught how it should be, how it affects your practice, and how it helped me a lot in my clinical practice. And the simulation program, it is wonderful. Hands-on on oocyte retrieval, that's a pickup, embryo transfer, IUI, hysteroscopy. Our teachers, they'll first explain us like how to get through. For example, when there is a case scenario, like where is the case when it's put with a simulator, they'll tell you how to go through. So when we did some 7 modules, we had an idea how to approach. So when we get a case with so many things, we know how to get into, to collect all the follicles, to not miss it, and without compromising a blood vessel. So that was very nice. And embryo transfer, they repeatedly made us feel to how we go beyond the internal loss, the loss of resistance. So repeatedly, when we do that, we can able to make the difference. Like as soon as you reach beyond the internal loss, you can feel the loss of resistance. So that's where you're supposed to stop. So that was nice. But none of us taught us like how to go through it. A very simple thing, how to approach a follicle, how not to miss it, like from what are the main things to be noticed, what is not to be done. Everyone can do, but the thing is like what not to be done is specified, so that we don't do that. So these are the practical points which I learned here so that I can apply it on my patients when I go back. Thank you.